Good afternoon, everyone. My name is Niall Wallace, CEO and co-founder of Infonaut. Prior to starting Infonaut, I ran performance management reporting for the province of Ontario's healthcare system. And as a group, we've spent the last 10 years dedicated to disease and infection surveillance. We're focused on solving the challenge of hospital-acquired infections. This is one of the leading challenges to human health, as indicated by the World Health Organization, CDC, and others. We expect infections in hospitals to exceed cancer deaths by 2050. That's once every 3 seconds. And the numbers recently were revised to demonstrate that 1 in 15 patients in the Western world entering the hospital leaves with an infection they didn't enter with. This is killing 100,000 people a year in the United States and costing about $45 billion. We've spent 10 years in surveillance, and we've pivoted over the last year, releasing a digital health IT tool with our friends at IBM Watson. We've graduated from the Watson Partner Program. We're now being officially sold as an IBM Health solution. We've developed a risk behavior and culture platform, which we believe is the only effective way forward to eliminating hospital-acquired infections. This slide should show how big the market is. It's estimated to be $82 billion in total spend by 2020. The addressable component is about $10 billion, and when we look at the IT market that we're focused on, it's about $4.5 billion by 2020. About 48% of the spend is currently in the United States, but the rest of the world, particularly China and Europe, is increasing their spending dramatically. We have been at the forefront of trying to understand how these infections are spread through hospitals, even though we have 40 years of focus on trying to solve this problem. The problem is getting worse, it's more dramatic, and the virulence of these infections and diseases are increasing. It is the most serious threat to human health care that we're aware of. What we've identified, and we were responsible for these findings up to 4 years ago, and we've been published in international journals, is that infections move through hospitals because people move them. And that probably doesn't sound like a surprise, but with reams and reams of best practices, world leaders are now following our example. The challenge, as outlined by the CEO of Leapfrog, who measures hospitals for their safety scores every quarter, is hospitals can't find the problem. If they can find the problem, they can't solve it. And even if they did think they could solve it, nobody's doing what they're supposed to do anyway. There's a machine out front which we hope you'll try. It measures how effective you are at your hand hygiene. Trials out of Johns Hopkins so far show that 70% of clinical professionals fail at hand hygiene, just at that, even if they are doing it.
I think you're going to need to hit postpone anyway.
I'm a Mac guy.
No, postpone. Welcome to IBM.
Okay. IBM sold out of that business. And I won't have you say anything bad about our partners. So the most effective approach is to change risk behavior and culture, and that's exactly what we've developed a score to measure. Using the IBM Watson platform, we are taking in survey instrument responses from clinical professionals. We rolled this out in July for free, and we had clinical professionals from 24 countries reporting in, giving us a global baseline and the new gold standard in understanding risk inside a hospital. Healthcare staff participate in this 15-minute survey. They receive 1.5 continuing medical education credits from our partners at University of Buffalo and our academic partners in the UK. And we apply artificial intelligence and machine learning to that data along with the other data that we combine in there. What we're doing is comparing the scores at an individual unit and system level to the global standards. We can prioritize those things that must change given the responses. We actually prescribe the interventions matched to the culture to make sure they're going to be accepted by the staff at a unit level. And the most important thing for the insurers is we're actually predicting whether hospitals can improve on a unit-by-unit level. When we were doing our surveillance project, which was led to the understanding we have now, we had success in Canada and the United States. We had a 40% reduction in infections across all infections in our US environment. This is $38,000 per bed savings because of the cost avoidance by the hospital. But more importantly, all of those quality metrics, things that we expected people to change their behaviors on and improved across the board to get us to the corresponding improvement. Uh, we were brought from Toronto by Dr. Nick Hopkins, who has established the Jacobs Institute across the hall. Our U.S. entry was accelerated by him. He found us. We moved the company from Toronto in 2014, and we've continued to grow here in Buffalo. We've committed to the Buffalo market. 2016 was an amazing year for us. In addition to being 43 North winners and accepted in the Critical Path program, I was awarded a scholarship to Harvard Business School, focused on healthcare, but we were also given a global award, one of the top 10 innovations in infection prevention control by an international journal. Our go-to-market has clarified over the last year. We are not selling to hospitals. Our partners are insurers. We are developing relationships with health risk insurers and healthcare providers as a quality initiative or a risk mitigation tool. They're taking us into their clients. The IBM channel is driving international sales. We have now connected with data aggregators in addition to the insurers to provide that data sale avenue for us. And we're proud to announce that Buffalo is home to the first Center of Excellence for Infection Prevention and Control, which we've opened across the hallway with our international not-for-profit partner. The value proposition is fairly clear to insurers, and I've included government in that group. Outside of the United States, the government really is the insurer in these single-payer models. This is what's led to adoption with our international partners. But we mitigate the risk inside a hospital, which reduces costs and has the follow-on effect of saving lives. Interestingly enough, the Israeli National Health Service has been the only one that's qualified lives as a metric in what we've been doing. We help the insurers develop customer loyalty, and they're all looking for new digital services leveraging the inherent ability within these new artificial intelligence and machine learning systems to become more competitive. We're selling right now. We're charging $25 per individual that's involved in the survey, although we've capped that on a per-site basis. This is recurring annually, and we have companies that are joining us in the Infection Prevention Control Center of Excellence across the hallway that are paying us $30,000 for a quarter, where we provide our expertise and assessment on their particular product. Really, the biggest gains are going to come from the data sales as we go forward. Infonaut owns all of the data and the risk products we're developing. So we started selling internationally to the UK market. I think an important consideration for us is that our sales cycle internationally is 39 days from "Hello, my name is Niall Wallace" until we receive a contract. We've made some deals with US healthcare insurers who are rolling us out as pilot quality programs. And we're in contract discussions with Google X. Google X is interested in our risk algorithms and the way that we're approaching the market as they develop their personalized prevention tools. Channel strategy is we're now being sold through international channels, IBM. We've just secured our first contract in Israel with the National Health Service. And we were the first company added to IBM's VA RFP response, which will be going in this summer. We're an approved Zurich vendor. We're the only vendor in healthcare that's been approved by Zurich. We are in addition to the risk engineering services. And we've started to approach healthcare unions because we have written some of the seminal papers on workplace safety and infections in hospitals. We've added 2 management team from Buffalo. We're proud to announce that Don Lee has joined us thanks to the support of the University of Buffalo. But the Canadians on the management team are now outnumbered by Buffalonians. And our advisor group has a total of 9 healthcare exits, including an IPO. We're generating revenue now. We've put our nose to the grindstone in terms of sales. We've generated over $120,000 in sales in the last 60 days, and we'll be cash flow positive by March 2017. We're raising money right now, and that's really to accelerate our path. We're focusing on the channel pathways into the market, but we have an opportunity to save a lot of lives globally, become the new standard in healthcare safety, and to do that, we're focusing on insurers and the data channels with groups like Google. Thank you very much.